Hi friends, today I will discuss one important case with you, that is fibrosarcoma. It is one of the rare tumor. What do you mean by suffix sarcoma? Yes, you are right. The sarcoma means malignant mesenchymal tumor. That is called as a sarcoma. Here there is a malignant mesenchymal tumor of fibroblast. That's why it is given the name fibrosarcoma. So the mesenchymal tumor of fibroblast is fibrosarcoma. What is the common age group for this patient? This tumor usually develop in a patient that is having greater than 30 year of age. The most common age group is between 35 to 40 year of age. Which are the common sites for the development of this tumor? So the common sites include soft tissue of the leg, of the foot, or of the trunk. Sometimes can be retroperitoneum. The leg is very common site. But you might be surprised that we have got the biopsy from the neck swelling and we have diagnosed the case of fibrosarcoma from this neck swelling. So that's very unusual site. But sometimes it can develop anywhere in the body. It's a soft tissue tumor. The recurrence is very common for this fibrosarcoma tumor. If you remove this tumor, then also it can recur. So the recurrence is very common. What is the treatment? The treatment is surgical excision. But you have to see for the skin margins or the soft tissue margins also. If it is positive, then sometime radiotherapy might be needed. So that is the general scenario of the fibrosarcoma. I have given the introduction. And now we will see how you will diagnose it microscopically. So it is one of the fibroblastic tumor. It's a fibrosarcoma. So there will be presence of fibroblastic proliferation. And the proliferation is particularly in the form of herringbone pattern. In the malignant mesenchymal tumor, there is always some amount of atypical mitosis. So the mitosis will be seen here. The atypia is very minimal. You will not see the giant cell that differentiate it from the MFH. We will discuss this later on. As this is one of the fibroblastic tumor, there is always present of some form of collagen tissue because fibroblast is having function of production of collagen. So the collagen is present. Now based on the number of mitosis, we are dividing the fibrosarcoma into the low grade, intermediate or high grade. So let's see in the different view, in the 10x and high power view. So what can you see here in this field? Can you appreciate fibroblastic proliferation? These all are the fibroblasts, spindle shaped fibroblast. So the fibroblastic cells are proliferated. That is very much obvious in this section. So you can be clear that it is the fibrous tumor. Somewhat atypia is present. It is mild one, but some form of atypia is always present. And there is usually presence of mitosis that we will see in another section. But what can you appreciate here? Just see the pattern of the fibroblast. This is the pattern. Just see these seeds. It's going in this way, right? This is the pattern. So this pattern is resemble like that of bones of fish. That's why it is given the name herringbone pattern. So if you see this pattern, then your diagnosis could be straightforward fibrosarcoma. This is a high power view of the fibrosarcoma. In this section, you can able to see the abnormal mitosis as well. Here is the presence of mitosis, right? These all are the abnormal mitosis. So the presence of mitosis points toward the diagnosis fibrosarcoma. Which immunohistochemistry marker can be positive in fibrosarcoma? So that is the vimentin. It is usually positive in fibrosarcoma. So you can confirm the diagnosis with the vimentin. So this is the another field of the fibrosarcoma. Again you can see the herringbone pattern. This is the herringbone pattern of the mesenchymal cells. So this type of pattern is seen in fibrosarcoma. Now, what can be the differential diagnosis for the fibrosarcoma? That is very important. Just remember that this fibrosarcoma may resemble like that of MFH or DFSP. So how will you differentiate it from MFH? MFH means malignant fibrohistiocytoma. It is nowadays known by the another name, that is pleomorphic sarcoma. In the pleomorphic sarcoma, the fibroblastic proliferation is present, but you can also able to see the epithelioid cells that are circular, and additionally you can see the some amount of giant cells. Usually giant cells are present in MFH and the cells are more pleomorphic. So the high degree of pleomorphism and the presence of giant cell and the presence of bizarre cells, that is very pleomorphic cells, are the characteristic of MFH. Same way, DFSP also can be differentiated by high degree of pleomorphism and the presence of giant cell. So you can differentiate this diagnosis from the fibrosarcoma, MFH, DFSP or fibrosarcomatous DFSP. In the fibrosarcomatous DFSP, the both components are present, fibrosarcoma as well as DFSP. But if pleomorphism is not severe degree and the giant cells are not present, then you cannot give any of these diagnoses. So that's why we have diagnosed the case as a fibrosarcoma. Again, I am summarizing. There will be proliferation of the fibroblastic cell. All these are fibroblasts. There is usually presence of pink colored collagen in between the fibroblastic proliferation. The pattern is herringbone. This is the herringbone pattern. You can see the some amount of mitosis. Here is the presence of mitosis. And the atypia is minimal. You can see that some of the cells having the high NC ratio and hyperchromatic nucleus, but you cannot see the prominent nucleoli, marked pleomorphism, etc. like features. And the cytoplasm is very scanty. If it is abundant, then it could be smooth muscle tumor. Right? So in this way you can diagnose the case of fibrosarcoma. Hope my video will be beneficial to you in making the diagnosis of fibrosarcoma. If you like my video, then subscribe my channel and don't forget to press the bell icon so that you can get notified whenever I am posting the new video. Thank you very much.